All right, good morning. We are going to continue doing the recording of the April 2000 United States congressional hearing regarding the autism vaccine connection. So far, it's been so valuable, I don't even know what to say. It was observed yesterday that several clips from this hearing were used in the movie Vaxxed, V-A-X-X-E-D, the first Vaxxed movie. I did not observe that. That's one of the reasons why I recognized the person who was a CDC representative yesterday. She wasn't a CDC director, but she was a fairly high-ranking, highly well-positioned individual, doctor. So I'm just going to go back a couple of minutes. We're starting at hour 3 and 46 seconds, and I will patch these two together and make the whole 6 hours available for your download, and I'll make sure I have a copy on YouTube so I can capture the full transcript of it as well. And I'm just gonna let it play. Like I says, like you, I have a very busy, very life here. So there's days where I just don't sit here, in the middle of my Legos and the screens all day long. And I don't recommend I recommend other people, do research and play with Legos, but to be in this particular situation, just not moving is a very, very bad way to live. I think it's very important to be on your feet and moving around as much as possible. So I need to get back to my moving around. I'm away from my keyboard. I'm not looking at any chat. I'm just doing other stuff, listening. Maybe every once in a while I got a pen and or marker. I'll write something down on a notepad or a piece of scrap wood or whatever. So here we go, just queuing it up, letting it run, and I hope you guys have a fantastic morning. I may interrupt for a couple of things, but I got a lot of other stuff to do today. So hope you guys are well, stay positive. Don't judge other people. Judge their actions. Try not to judge others. Yesterday was I had a very stressful moment yesterday, a couple of hours actually. And I did some praying, and I just asked for some way to get through it. And sure enough, the passage that I was led to read yesterday was exactly what I needed. And I got in the right mindset. And sure enough, what I thought was going to be something which was horrible, it wound up getting resolved. And I'm thankful for that. So you never know. Just follow the guidance. Love you guys. Here we go.
This was before they received the MMR vaccine.
We have an epidemiologist in the audience, and where is he?
I'm going to go back just a little bit more.
Would you mind?
Statement isn't true. From 1988, those from 1988, there was a major effect on mothers' confidence. Understanding and treatment must be based
lives, because from the minute we are born, we are capable of meeting challenges at all sites. To review, here are the medical facts. First, if autism is a consequence of autoimmunity, then the incidence of autism would have decreased, not increased, after vaccination. Second, children from birth are confronted with and manage an enormous...
I can't bear it. I'm actually just going to start at 3, like I said. I can't. I can only take so much off it in one day.
True, Mr. Chairman. We did include the children involved in the catch-up campaign in our analysis, as is clearly stated. To suggest otherwise, and I suspect the suggestion comes from Mr. Wakefield, is malicious.
Well, was it included? Was it not omitted in the original paper that you submitted?
All cases were included who received MMR vaccine. All cases, we also did additional analysis with all cases who received any measles-containing vaccine.
Didn't some of those 36 children receive the MMR vaccine after after the...
We looked, I think what you're referring to is the reply which we put to Mr. Wakefield's criticism of our paper in The Lancet. And I have to say that his is the only critical scientific paper, the only criticism of our paper which we've received on a scientific basis. All other reports have been constructive and supportive. What we looked for there was the children who had received MMR vaccine, which we had included in our analysis. There were 36 such children. 29 of them, there was evidence regarding when the parents became concerned about their child's development. In all cases, this was before they received the MMR vaccine.
We have an epidemiologist in the audience, and where is he? Would you mind coming up? I'd like to have you sworn in real quickly. Do you swear to tell the whole truth, nothing but the truth, so help you God? Thank you. Can you explain the importance of properly counting these children born before 1988 who were given the catch-up vaccines?
Well, as implied
order,
by
Mr. Chairman,
Professor...
Point of order, if you'll suspend your answer to that question. I want to make a point of order.
You gentleman will state his point of order.
The rules of this committee require that we be given witnesses appearing before the committee shall, so far as practicable, submit written statements at least 24 hours before their appearance, and when appearance in a non-governmental capacity, provide a curriculum vitae and listing of any federal government grants and contracts received in the previous fiscal year. Identification of witnesses are to be provided to members of the committee. Suddenly, we have a witness being called forward. The Rule 2 says every member of the committee or the appropriate subcommittee, unless prevented by unusual circumstances, shall be provided with a memorandum at least 3 calendar days before each meeting or hearing explaining, 1, the purpose of the meeting or the hearing, the names, titles, background, and reasons for appearance of any witness. The ranking minority member shall be responsible for providing the same information on witnesses whom the minority request. Suddenly we have a witness being called forward. We have all of these people to testify. And we have now a witness come. I don't know who he is. It just seems to me that this is in violation of the rules.
I think as you were reading there, where there's unusual circumstances, and I believe you can go back and read that again, or whenever practicable, was another term that was used in there. And so the chair, we'll suspend for one more.
Mr. Chairman, if I might be heard, and I'm going to withdraw my point of order. But I do want to say that there are procedures for the conduct of hearings which provide for opportunities for all points of view to be expressed, and for a witness to be brought out of the audience because the witnesses before you didn't give you testimony that fit with your preconceived theory seems to me could turn a congressional hearing more into a circus than a genuine fact-finding opportunity. But I won't object if you want to call this witness. I do want to also point out that we have rules on the time that are allocated to members, and I would insist that that time be observed, or that all members be given the same open-endedness that I see about to come in your questioning, because the clock that usually keeps time for our questioning has been deliberately stopped. I will not object, but I do think it is inconsistent with the rules of this committee to bring witnesses out of the audience when you have a panel here that just testified to whom we ought to pursue our questions, with whom we ought to pursue our questions.
parliamentarian has just informed me that where there are extenuating circumstances, that the chair has the ability to bring a witness forward. And this is not the first time this has happened. That's the first thing. The second thing is, this is one of the most important hearings I think we've had, because we're talking about an epidemic of autism that's taking place in this country. And if there is information that's being given to the committee that's going to be in the congressional record that is not accurate, it needs to be corrected as quickly as possible, so that the American people and people from around the world who may want to look at the record of this committee have the facts. Now, if we have an epidemiologist here who has expertise about a report and can cite that information about this report where there might be an error, then we ought to correct it right now instead of waiting until a report is filed, goes out to the American people, and then try to correct it where there might be a misunderstanding.
Well, we do have an epidemiologist on this panel, and perhaps he ought to question her, or this other witness should have been asked to testify. No one would have objected to having anybody who had anything pertinent to say to us have an opportunity to present what they have to say. Mr. Chairman, let's proceed, and let's keep the rules on time, or acknowledge the open-endedness of questions, because we'll have a lot of questions as well.
Dr. Spicer.
Very briefly, Congressman Waxman, your points are well taken, and I respect them. I will say now to Professor Taylor that those additional cases in the catch-up campaign may well have been included in the paper, but were not clearly segregated or identified or enabled peers to evaluate the possible impact of including them or not. So the findings may have been misleading until we reanalyze them, taking that into account. Moreover, the use of the case series strategy of analysis is unconventional, not accepted by mainstream, and leaves the paper at best as a hypothesis-generating study, and not something with which he or anyone can categorically say this proves that there is no relationship. It just shows and emphasizes what he said himself, is that we need to study it further. So we have a compelling reason to have a blue panel, international panel, to go back to that database, look at the raw data, and be able to come up with a second assessment that's verifiable by the scientific community and the relevant community. Thank you, Mr. Waxman.
Thank you very much.
Can I
point of order, Mr. Chairman?
Can I comment on that?
Stop the clock. Gentleman will state his point of order.
Is Mr. Taylor going to be given an opportunity to
comment
respond at this point in time? I think it might be helpful to those of us who are sort of surprised by this new witness. I'd like to hear what Mr. Taylor has to say in response to that. I think it'd be educational.
I have no objection to him responding, but I have some more questions of Dr. Wakefield. So
Mr. Chairman, my point of order is, can we have it nearer in time to each other so we get the full benefit of it, rather than go back and forth?
Next, he can have the time next, or Mr. Waxman can, and he can yield to Dr. Taylor. Dr. Wakefield, would you come back up, please? Dr. Wakefield, would you kind of clarify the difference of opinion that you have from your colleague?
My anxiety, Mr. Chairman, is that if you test a step-up hypothesis, that is, those children who should be the first to receive the vaccine at the age of 1 year, born in 1987 because the vaccine was introduced in the UK in 88, therefore they would have been 1 year old, then the takeoff, if there was a relationship between MMR and the vaccine, should have occurred at that point. The paper illustrated the point the takeoff occurred before those born in 85 and 86. Now, what took place when the MMR was introduced was the catch-up campaign where all children of 1 to 4 years of age were targeted. It was an aggressive campaign. I know that because one of the authors on the paper that we published in The Lancet was in charge of that campaign for Hackney in northeast London. That if you give the vaccine to children over the age of 2, then it will cause the takeoff to occur before 1987, and that's exactly what occurred. Now, at the very least, those cases should have been mentioned, because the reviewers, in the absence of those data, cannot give a valid interpretation of the paper when they make a recommendation for it to be published or not. and they should have been excluded from the analysis so we could see how the graph looked without them, and that did not occur. And that is a major anxiety.
Dr. Taylor, you want to respond now?
Well, it does seem slightly surprising that at one moment we're accused of excluding them, and therefore that upsets the results, and now we're accused of including them, and that upsets the results. I have to say, the time relationships, the step-up part of our paper, is the least important part of our findings. The direct findings, the time series analysis, is much more important, which is the direct evidence that the individual children did not develop symptoms of autism within various defined periods after they received the MMR vaccine. If I could just comment on Dr. Spicer's comment. Again, he describes our analysis as unorthodox. I mean, we use the highest standards of epidemiological and statistical analysis in our handling of this data, and this data has been reviewed by numerous experts, both prior to publication and since. Last week, our research was the basis of a detailed debate at the Royal Statistical Society, where there was no criticism of the statistical techniques that we used, and the conclusions of our paper were accepted by this very expert group. The testimony which you've received from Dr. Elizabeth Miller, who's an epidemiologist, and Dr. Petty Farrington, who's an expert statistician, is tabled for the committee's consideration.
Would you mind, since there is this strong difference of opinion between you and Dr. Wakefield and I presume some others, would you mind providing the data for your study to the committee, complete data?
I'll have to take advice on that from both my colleagues and the others. I would be required to decide whether the committee is an appropriate body for this information, which was collected, as you know, for the Medicine Control Agency, which is a branch of the Department of Health in the UK.
Well, if,
in principle, I have no problem, but in practice, I would need to check on.
We would be very happy to write to the Department of Health in the UK and ask that you be able to release that information to the committee in total, so that we could have somebody who's totally non-biased on this issue, hopefully,
yes,
to analyze it.
I think it would need to be done by more than a selected statistician. I think it should be done, if it is to be reanalyzed, it should be reanalyzed by independent individuals, which of course is the problem in much of Mr. Wakefield's research, that it has never been independently verified. No one anywhere in the world has been able to reproduce any of his studies. And it seems possible that it's only going to be a matter of time before this most recent information is also
my time has expired, but let me just say I believe that Dr. Wakefield and Professor O'Leary and others would be willing to give us the documentation and the study that they did, and we'd like to have yours as well so we can look at all of that. Mr. Waxman.
Mr. Chairman, because I believe autism is such a serious problem, I'm troubled by this hearing. This hearing was called and structured to establish a point of view. As the point of view of the chairman. The chairman believes a particular point of view, and that's a connection between autism and vaccinations. And you can look at it by the first panel, where we had 5 parents, all of whom believed the same thing that the chairman believed. And the way we just had the handling of the questions a minute ago. What also bothered me is when we asked that we have the American Medical Association or the American Public Health Association or the National Network for Immunization Information or the former Secretary of HHS, Dr. Lewis Sullivan, real experts in addition to those we had before us. We were told no, they can't fit in. I think hearings like this have a real danger, because if you sensationalize the idea that there's a connection between immunism and autism, immunization rates will drop. That's what happened in Great Britain after Dr. Wakefield published his first study, and immunizations dropped. Autism rates didn't drop, but measles rates increased. I was impressed by the statement that we had a drop of just 10% in measles immunizations in 1990, and then we had 11,000 people who were hospitalized from measles. This can cause brain retardation and death. We know we can prevent that. Why should we not scare people about immunizations until we know the facts? And I fear that what we have in this hearing is a sensationalization by the chairman in order to get all these cameras to report to the American people that there is this connection, because he believes it and many other people believe it, and therefore a lot of others who watch this will think, well, I won't immunize my children. Dr. Wakefield came out with a report in England, and the first group to examine his claims was the Medical Research Council, which is the British equivalent to the NIH. And they found no evidence to indicate any link between the MMR vaccine and bowel disease and autism. After they did their work, the chief medical officer of the
Vaxxed versus unvaxxed. It's vaxxed versus unvaxxed. I mean, if they looked at completely unvaccinated people, no vaccines ever, they would not find autism. Instead, they're trying to connect autism with a vaccine. And you take out one vaccine and I got to turn the audio on this down over here. The way this is being looked, it's unresolvable. It's totally unresolvable. They're trying to make an autism or I should say an MMR or a part of the MMR to autism connection. If they just looked at people who were never vaccinated, they will almost never find people who are symptomatically autistic. Of course, there's still the use of the disorder versus damage. And then there's, well, if you do not get it, you're measles. And if I believe it is known that you can test people who are sick or at least have some symptoms and are expressing a symptomology called measles, and then use these non-specific PCR tests, and voila, you find measles. And the way Waxman mentioned it, well, if you don't have 10% of the population MMR or whatever, you get 8,000 cases. Well, that sounds like it's an exponential increase, but even just entertaining that argument lends credence to the possibility that people are getting sick only. First of all, people are sick, not just a healthy person who tests sick, because there's a lot of people who test sick. We found the non-specific sequence, but he suggests it's a non-exponential increase, which is absurd. So these are all little games which can be played. If what Wakefield's not doing is laying it down like, look, people can test positive for this stuff even though they don't have any symptoms. You can describe any illness or a variety of illnesses as measles, possibly, and just look at people who are not vaccinated. Waxman also made a statement, people stopped getting vaccinated and the autism rates didn't go down. Well, of course, because autism observability lags several months or probably a few years, or I should say, let's just say neurological damage, neurological injury lags the actual administration of the damage or injury causing event. So, of course, no drop was going to be observed. There's a few people here who are probably, and I suggest Representative Burton, who's running this, is on. I suspect, I'm going to give him the benefit of the doubt. Maybe he didn't earn it. That he is unaware of how the maze has been created. But no one's going to find any answers in this hearing. And noteworthy, if I played this audio today, cleaned up a little bit, you would not be able to know if the audio was from a year 2000 hearing or a year 2025 hearing. How is it possible that all of these scientists and intellectuals and doctors and policy writers have gone a quarter of a century and haven't moved the needle 1 nanometer? They are exactly where they are. It's because it's almost if it's been framed from the beginning to be unresolvable, unsolvable, a mystery. And everyone feels as though they're getting the short end of the stick. And everyone's deferring to the smooth talking, sophisticated sounding. I mean, you just imagine Wakefield there, well, with a glass of cognac, just sipping it and using his smooth, sophisticated British, thesaurus of a tongue. And everyone's like, oh, Wakefield, there's nobody it talks more sophisticated or intelligently than this. Everyone is boxed in. It's very, very nefarious.
The United Kingdom issued a letter to doctors in 1998 stating, based on the previous material that I have seen
and I remind you, everyone loves to say that 1986 Immunization Act is Reagan. How many times? Reagan. It's Republicans, Reagan. And it's true. The Republican Party does historically have a whole lot more to do with advocating for immunizations than the Democrat Party. It's true. The Democrat Party has had a position of offering more protections, or I should say protections of people's ability to choose. Somehow that starts to flip during the 1990s. But up until then, or at least it neutralizes, and then it kind of goes the other way. Waxman is one of the largest voices in that 1986 act. You can go look at the newspapers. You can see his concerns about vaccines not being approved because of the cost of testing and all this other stuff. We need to protect the manufacturers, 84, 85. But no one mentions Waxman. I believe he's passed. Nobody mentions Waxman. It's just Reagan's act right now. And I believe all Reagan did was sign it. And I know here I am adding too much color to this. But I want to remind you that in 1986, when this act is going through, there's, of course, a lot of congressional hearings, as you can imagine, about this stuff. But when there is a luncheon at the White House to discuss such matters, about probably things like the Immunization Act going forward, who does Reagan sit next to? He sits next to Joshua Lederberg. It's funny, again, just the giant that no one wants to talk about. Let's just ignore the person that was hired and appointed by Rumsfeld to run the internal Pentagon investigations. Let's just ignore the person that was consulting Reagan on the nuances of this Immunization Act. Let's just ignore the person that was put in charge of planetary defense, meaning protecting the planet basically from microbes. Let's just ignore the person who co-authored the paper on bacteriophages being used as a method of biological or genetic communication between bacteria and making it possible for bacteria to accomplish effectively sexual reproduction. Let's just ignore the person that was one of the main signatories on the biological weapons treaties in 1968, 1969. Let's just ignore that person that was a top aide to 7 U.S. presidents on the topic of the Human Genome Project and biological weapons. Nobody will mention this person. The ignoring of Lederberg is actually, it's sort of like ignoring Lee Harvey Oswald and trying to talk about the Kennedy assassination. I don't understand how so many other citizen journalists, independent researchers, are captive to the point where they won't talk about the most important people in history. It's all garbage. I don't know what else to say. They are all captured narrative controllers, or almost all of them are garbage. I'm not making some impassioned point that, I'm right and everyone else is wrong. I'm simply highlighting what the data shows and then emphasizing that nobody else will mention it because it will help people make too much sense of exactly what happens or has happened or possibly why it's happened or get insights about the current pandemic, 9/11. He was only in charge of the boards reviewing Gulf War syndrome. Meryl Nass said she never even met him. I mean, come on. Sorry. Maybe that was just the caffeine getting to me. Let's get back to the show.
On the opinion of experts, President of the Medical Research Council, I have concluded there's no link between measles vaccine or MMR immunization, etc. And then the World Health Organization looked at his study, and they came up with a statement that said, given our view that previous scientific claims made by Dr. Wakefield and colleagues lack scientific credibility, that his present study does not meet the requirements for establishing such a causal relationship. I don't know whether that's true or not, but that's what the scientists in England said when they evaluated, as did Dr. Taylor when he evaluated Dr. Wakefield's study. Now, Dr. Wakefield's testified he's got some new information. Fine, let's get the new information out there. Let's let the epidemiologists evaluate it. Let's let scientists explore where the truth may be. But to put this out in a congressional hearing and to scare people from getting immunizations, we know that without immunizations, dreaded diseases will occur. Deaths and mental retardation and disability will occur among our children, and we could prevent it. What we don't know, and we have a lot of information to the contrary, is that autism will result from that immunization. Dr. Taylor, well, let me ask Dr. Boyle. You're an epidemiologist. Suddenly we had to pull out of the audience an epidemiologist. You're an epidemiologist. What do you have to say about this debate we're seeing back and forth? Have you evaluated any of this information that's now being presented as if it were fact?
I think that the scientific data currently does not show an association between the MR vaccine and autism. We've heard from Dr. Taylor. We also know that there is a study in Sweden by Dr. Gilberg and Associates who has been monitoring, it's the only country actually that's been monitoring the rate of autism over time. And they looked at pre-MMR immunizations and post-MMR immunizations and found no changes in the rates of autism.
Well, I can't tell you what's true or not, but I don't think our chairman can tell you what's true or not either. And I feel when we had this hearings on whether there was campaign abuses by Democrats, a lot of people's reputations were ruined, and I thought the hearings were unfair, but those were political. The consequence of an unfair hearing on autism connected to vaccinations can cause people to die. And I worry about that, and I think we ought to get the facts before we make the assertions, and not make the assertions and then throw out the witnesses who tell us information that doesn't fit those allegations. Yield back.
Gentleman's time has expired. Does the gentlelady from Florida?
Thank you so much, Mr. Chairman, and I thank you for holding this hearing rather than have some questions because I'm needed for a caucus in my other subcommittee. I wanted to thank you, Mr. Chairman, for the importance of this hearing and for highlighting the need for further research as we explore the possible causes, intervention strategies, counseling, and other services to help families who are living with autism. We need to keep in mind that a person with autism is indeed a person first and not a behavior. And these posters that I would like to have the audience and the panelists see are of constituents of my congressional district, Bonnie and Willis Flick, two beautiful children in my district who are living with autism, and indeed the whole family lives with autism. Bonnie and Willis are fortunate to afford treatment and therapy, but so many other families are not as fortunate. And I thank you for the opportunity to hear from researchers and from parents and people who cope daily with this disease. And I commend you for your initiative, Mr. Chairman, in seeking answers to help those individuals with autism and for the opportunity to to learn from experts and researchers. And I especially want to thank you for allowing Dr. Kathy Pratt, the director of the Indiana Resource Center for Autism, for allowing her to come to share her expertise on what we as policymakers can do to help families dealing with autism. Approximately 50% of Florida's children with autism reside in my community in South Florida, and I'm delighted to have you take this leadership role, Mr. Chairman, and have your committee address this issue so that one day we can find prevention and methods and a cure to help us all cope with this rising curse of autism. I thank you very much, Mr.
The gentlelady yield
Yes.
to me. Let me just ask Dr. Wakefield, because I want to get through this panel and get on. Would you be willing to give us all of the information on your study so it can be reviewed?
Certainly.
You will?
Yes.
Thank you very much. Professor O'Leary, would you be willing to give us all the information on your study so we can review it?
Yes, sir. No problem.
I can't hear you.
Yes, sir.
Okay. Dr. Singh, would you be willing to give us all the information on your study so we can review it thoroughly?
Yes, absolutely, without any hesitation. Mr. Chairman, if there is a moment, if I may have a chance, I would like to raise some interesting point later on.
Just 1 second.
Yeah, thank you very much.
Now then, Dr. Taylor, would you give us all the information on your study so we can review it along with the others?
In principle, I have no problem, but I would need to discuss that with my employing authority, University College London, and with the Department of Health who funded this study.
Who funded your study, Dr. Wakefield?
We did. We have a small charitable contribution, but
charitable organization did.
We found it a little difficult to get funded.
And yours was done by the government?
It was funded by the Medicine Control Agency, which is a body charged with responsibility for the safety of vaccines and other treatments.
Well, I would be happy to work with the ranking Democrat, Mr. Waxman, to get an independent group of doctors, scientists that we mutually agree upon to review all of your work to come to some kind of a conclusion if it's possible. And so since Dr. Wakefield and Professor O'Leary and Dr. Singh have all agreed, we'd sure like to have yours, and I'll be happy to write a letter, as I said before, to the authorities in England asking for your report, and hopefully we'll get that along with the others so we can review them side by side.
Mr. Chairman, just on that point, because I want to agree with you.
Sure. Mr. Waxman.
I drafted a letter, and I'm going to share it with you, and I hope you'll join with me on this letter to Secretary Shalala. And we say in this letter, because of the vital public health importance of childhood immunization, as well as the growing concerns over the prevalence of autism in the United States, we urge you to convene under the auspices of the National Institutes of Health, the Centers for Disease Control and Prevention, and the Food and Drug Administration, an expert panel of leading scientists and clinicians to review whether there is any causal association between vaccines and autism, given the grave possibility that immunizations against life-threatening childhood diseases may decline as a result of unsubstantiated allegation of vaccine-induced autism. I would want her to act as expeditiously as possible. Perhaps you'll join me in this letter, because I think the only proper thing to do is to get the experts to evaluate all these conflicting claims, because I wouldn't want the American people, as a result of this hearing, to stop being immunized if these claims are not
well, let me reclaim my time and say, nor would I. But one of the concerns, the time is right here. It's on the clock. But let me just say that the Department of Health and Human Services and Donna Shalala and the others have some very competent people over there. We have been checking into all the financial records of the people at the FDA, HHS, and CDC, and we're finding some of those people, and even on the advisory panels, do have some possible financial conflicts, as was expressed in the New England Journal of Medicine just recently on their front page. And as a result, I will join with you to get an independent panel to review all of these studies, but I want to make sure they're not controlled by the health agencies of this country that may have some people that have some possible conflicts of interest. And it's already been expressed in the New England Journal of Medicine, and we believe that also possibly exists with some of the agencies of our health services here in the United States. And so I will join with you, and we'll pick them together, And we'll try to make sure we have some people that are totally unbiased.
Well, independent means no conflict of interest. I wouldn't want a panel that had people with a conflict of interest, but I do want a panel of experts, and I think that the NIH and the CDC and the FDA can give us a panel that can do this evaluation.
Well,
why some people find that amusing, but
well, so long as we find there's no conflict of interest, we wouldn't have any problem with that. Mr. Tierney.
Thank you, Mr. Chairman. I have to say that I'm a bit disturbed with the nature of this hearing and the direction it's gone, and only because I have a considerable number of people in my district who have not only children experiencing autism, and they deal with it every day, but we have a number of institutions that have been working hard to give people the kind of support that they need to deal with this situation. And I find this hearing taking on a lot different tone other than a hearing that would like to look at some solutions and work together in a cooperative way to find out just what we can do. I do note that Representative Michael Bilirakis from Florida has some legislation filed. One of the provisions would authorize funding to the NIH to establish centers of excellence that would conduct basic and clinical research into the causes, diagnosis, detection, prevention, and treatment of autism. I congratulate the members of this panel that are co-sponsors on that legislation and hope that that's the direction in which we will proceed, because I think we need to find out what the causes are. First, Dr. Boyle, you're an epidemiologist. You know, lawyers have an easier word to say than you people go around doing that. But given your background, have you examined the evidence that autism is increasing in the United States?
We do know that the rates of autism appear to be higher than previously thought. And as I said in my testimony, they range from 10 to 15 per 10,000, but that's really from studies from other countries. We don't have, we had prevalence studies conducted in the United States. There were 2 done in the 80s, found very low rates, maybe methodologic reasons for that. At CDC, we've begun to develop a monitoring program at CDC. It's only for the Atlanta area. We have our first year of data collected. We're in the process of reviewing the information on the children with autism, and we hope to have a rate fairly soon. And we'd like to see some similar activities in many other locations. We have a wonderful model in birth defects. They're many years ahead of us in terms of trying to understand the causes of birth defects, and there's about 35 states that monitor birth defects on an ongoing basis. That doesn't happen for developmental disabilities. And we need to make that happen.
Right. There are people in my district, particularly in the Merrimack Valley area, who seem to have at least acknowledged an increased number of reported cases, if not of autism itself, of one of the other related diagnoses or whatever. Okay. Have you heard of or at least had
It's a difficult issue because the diagnosis for autism has changed considerably. The first studies were based on these fairly narrow criteria from the way it was originally described. The more recent studies have actually used criteria that are much broader, and there's increased recognition. So we really don't know. There have been a number of investigators who've tried to see whether or not the increase in the rates over time, or the higher rates in more recent years, is really due to a real increase or this sort of redefinition and better awareness. And it's not an easy question to answer.
I bring that up only because in one instance at least, a group of very active parents with children with autism worked with the school system and some other researchers and heightened the awareness of identification and found a marked increase in the number of cases that were beginning to be identified in the area, as though people had not really appreciated these symptoms, including some doctors, pediatricians who would look at it. That sound right to you?
Well, the one study that has addressed this is the study by Gilberg, which I mentioned earlier, was able to look at trends over time. And if you look at the range of functioning of those children over time, it appeared to be that the increase was in children who were higher functioning as well as children who were lower functioning. So the classic groups seem to remain constant. Now, why that's happening, we don't know. That's what we hope to do the research to understand.
Well, I agree that we ought to do this research and do it soon. I'm a little bit concerned about what might be the message taken from this hearing by people of what we want to take on this. Dr. Boyle, if you had young children today, would you vaccinate them?
I do have children, and they are both fully vaccinated, and I would vaccinate them again.
Dr. Offit, how about you?
Yes, I have a 7-year-old son, Will, and a 5-year-old daughter, Emily, and they're both fully vaccinated.
And you do it again?
Of course. I want them to be protected against the viruses and bacteria that can cause serious disability and death. I'm fortunate, actually. I mean, I was a little boy in the 1950s, and when I was a little boy in the early 50s, there were 4 vaccines: diphtheria, pertussis, tetanus, and smallpox. I was fortunate that I wasn't killed by measles or paralyzed by polio. My son, hopefully, didn't have to be as lucky, but hopefully, as we move into the 21st century and can develop vaccines against respiratory syncytial virus and paraflu, children won't have to die from those diseases.
Dr. Way, you wanted to add something?
I did want to mention one thing. We do monitor the trend of other serious developmental disabilities in Atlanta, and just based on my own experience over the last 10 years or 15 years, we no longer see. We used to see children who were deaf due to congenital rubella, and who had mental retardation due to Haemophilus influenza type B. We don't see those children in our program anymore.
Gentleman's time has expired. I just have a few more questions, then we'll go to the next panel. I think that Mr. Waxman has a few as well. Ms. O'Boyle, or Dr. O'Boyle, why did the CDC ignore the pleas of the parents of Brick Township when they begged CDC to look at the vaccine issue?
Actually, the study in Brick Township is sort of our first step, which is to look at the prevalence of...
Did you check into the vaccine issues, or the parents there wanted the vaccines looked into as well? Did CDC check it?
The concern for the parents from Brick Township and a number of meetings that we've had with parents was related to environmental concerns.
They didn't ask.
We've been working with the Agency for Toxic Substances and Disease Registry.
Didn't they also ask that the vaccines that they'd been given to their children also be investigated?
That's not my understanding. My understanding was that their initial concern was to answer the question, is the rate of autism in their community higher than what they thought it was?
Well, the information that we have is the parents of Brick Township were very adamant that they wanted the vaccines checked because they had so many of their children that became autistic. And evidently, that's not one of the things that CDC is looking into, and I'd like to pose the question to you and have you answered in writing. Why? Why didn't CDC include, as one of the things they were investigating, the possibility that some of these vaccinations may have caused the autism increase? So would you check that out and let me know?
I'd be happy to.
Okay. Let me just... Yeah, you have shown the measles virus in the intestines, and you have, in your laboratory as they call it in your country, you have gone through and checked those samples that was sent to you by Dr. Wakefield that showed that there definitely was measles in the gut of these children that became autistic. I think Dr. Singh verified the same thing. Did you check any of that, Dr. Taylor? Why there was measles in the guts of those children? Did you take a look at any of that?
I'm sorry, I haven't yet had a chance to look at this paper. It's interesting information. However, in terms of Mr. Wakefield's history, all his initial results, he's found the cure for, first of all, Crohn's disease, and he's found the cure for...
Let me just ask you this. I don't want to go into those other things. Dr. Wakefield showed us on the slides that there were measles in the gut of these children that were vaccinated with the MMR shot. Professor O'Leary verified it in a separate laboratory.
Not in a separate laboratory. That was the same laboratory. And that, I think, is the critical point.
Well,
this information does have to be verified by independent laboratories.
It was sent to him, and of course, Dr. Singh, I think, verified it as well. And you have not, though, looked into the problem with the measles in the gut of these children, though.
I don't know quite what you mean. That's not my area.
You have not checked into it. Okay. Professor O'Leary, did you want to say something?
Sir, can I make a comment, please? What I present is evidence, direct evidence, cell-based and tube-based. It was done at a separate laboratory from Dr. Wakefield's. If Professor Taylor has a beef with me, he should say that. But my work is completely independent. I stand over it. I've come here to tell the truth. There's nothing for me to be gained in not telling the truth.
Dr. Singh, you had some more comments you wanted to make. I'm going to yield you the balance of my time so you can...
Just a couple of things. Basically, I want to raise the issue that when we think about epidemiological studies, what these individuals are really looking at. All they do is they take numbers from previous old records or whatever have you. They don't even pay any attention to the fact that old-time vaccines were made based on old immunology. Today, immunology is so different, it's almost difference of day and night. And so we need to take into the account that new research should be really evaluated by so-called expert epidemiologists. Second thing...
Well, let me just say one more thing. I want to ask Dr. Boyle one last question, and that is, do you believe anybody who's getting funds from Merck or any of the other pharmaceutical companies should be on advisory panels that are making judgments about pharmaceuticals coming from those companies? Or do you believe that's a conflict of interest?
I think that's a difficult question to answer.
Wait a minute, let me get this straight. You think it's a difficult question to answer if somebody is getting funding of some type from a pharmaceutical company for them to sit on an advisory panel that's approving or giving their approval to a new drug that's coming on the market? You don't see that as a conflict?
Mr. Chairman, I'm Dr. Schwartz. I'm a colleague of Dr. Boyle's and am the Acting Director of the Epidemiology and Surveillance Division in the National Immunization Program. And we appreciate your indulgence in allowing me to testify and to help with answering questions about immunization. The Advisory Committee on Immunization Practices is a chartered advisory committee under the FACA regulations. There are very strict guidelines regarding the participation in votes of members who may have conflicts of interest that will help assure that those potential conflicts of interest, that those potential financial conflicts do not affect the vote and the decisions of the advisory committee. The reason why individuals who may potentially have conflicts are included in the committee is to assure that we get the best expert advice possible so that we can make the best vaccine recommendations possible. And frequently, the best experts are those who may have done research or may have provided information to some of the vaccine manufacturers. But their role in the committee and in the voting process is very strictly defined. It's also important to point out that recommendations for vaccination are made independently by the American Academy of Pediatrics and the American Academy of Family Physicians. And those recommendations are virtually always in harmony with the recommendations from the Advisory Committee on Immunization Practices.
Well, I'm going to go ahead. My time has expired, but I'm going to come back to you on that. We'll get back. I'm going to take another round on that. Mr. Waxman.
I want to say to the parents in the audience and to others, family members that are here, I don't want you to think that in any way I'm trying to minimize what you've gone through or to in any way challenge the depths and sincerity of your feelings. I think that's a separate question from the scientific question of whether there is a causal link. And because it's so important, we need to be able to, in fact, it's essential that through sound science we determine this fact, not through emotionalism and not through sensationalism. I didn't come here to say one side's right, one side's wrong, but I want us to have the best scientific information. Now, Dr. Offit's integrity has been challenged, presumably because he has a point of view that doesn't quite fit with the chairman's point of view. Dr. Schwartz started to indicate why he thought what your situation, even though you have a relationship with Merck, didn't put you in a conflict. Let me ask you directly, do you have a conflict of interest? If no, why not?
No, I have no conflict of interest. What I have is I have an apparent conflict of interest, and for that is why I disclose that at the beginning of every ACIP meeting, and that's why I disclosed it in my written report. Just so if I can explain this a little bit. I've been doing research for 20 years on rotaviruses. What I've done in my laboratory is I've tried with my colleagues to understand what the genes are that cause diarrhea and what the genes are that help the body fight infection. That led to a patent on a vaccine for rotavirus. Rotaviruses kill 14 children a day in this world, and rotaviruses cause 1 out of every 75 children born in this country to be hospitalized. It's a serious and in developing countries often a deadly infection. It would be an advance if we can prevent that disease. Merck and company has made a commitment to developing that vaccine, and hopefully if we can develop a safe and effective vaccine, then we can prevent what's a lot of disease and death.
I think that everyone here should agree that we want a safe vaccine, or as safe as possible vaccine. Merck didn't hire you to come up with a particular position, did they? Did they tell you they want your research to have a certain outcome?
No, this work was all done, frankly, it was funded by the National Institutes of Health. I mean, it's just funded by research that we did as a basic, I'm an immunologist and a mucosal immunologist. That's my expertise.
There's an organization, and I want to put this in the record, called the Autism Autoimmunity Project, and I have a letter from the president urging people to give money to it because this project is going to fund research that is going to show the connection between vaccines and autism and other diseases. And they proudly say they fund Dr. Wakefield and Dr. Singh. Is that true?
Yeah,
it's true, Dr. Singh?
Yes, I just received some money from that foundation about 2 months ago. My research is going on this issue for the last 15 years.
Yeah. And I'm not saying there's anything
I just
wrong
want to make a point on that.
Although this organization seems to have a particular point of view, how would you think they'd feel if your research came up with a different conclusion than what they wanted to achieve in their because they have a position they want in their research.
Mr. Waxman, I'm a very honest, decent human being, unlike perhaps some other people that you might know of. I can tell you that if I found a connection which was not existent, or if my results did not support what this foundation wanted, I will even return the money to that foundation.
Even though they want a particular, they want to prove.
They never asked me to do any research.
You're an independent scientist and you have integrity. Just answer yes or no, because I do want to ask.
Beg your pardon? Please repeat.
My question to you is, they have a point of view, but they fund you, you have integrity, and you're going to do your work based on science. Is that your answer?
My answer is that I am getting funds from private sources because national agencies continue to decline my research grant proposals when I submit. Where else I'm going to go to get the funding? I'm trying to raise funding independently, my own, not necessarily.
Have you been turned down by NIH?
3 times. I have attempted 3 times. I've written grants. NIH has not given me a single dime.
I want just Dr. Wakefield to be able to answer the same question very briefly. Dr. Wakefield, you acknowledge you receive money. Do you feel that in any way raises expectations that your research would come out with the result that this organization wants?
We are funded to test hypotheses, and we present the data whether the hypothesis was correct or not, and we have done that. We've gone on record as doing it. We published negative studies in association with measles and Crohn's disease. That doesn't mean it's not there. It means that our hypothesis was wrong in terms of we could not find it using the technology. So we have gone on record as publishing both positive and negative data.
I ask unanimous consent that these documents from the Autism Autoimmunity Project be put in the record, and I would note, Mr. Chairman, you're also associated on the board of this group, too.
Without objection, that's no problem. I see this as a little bit different situation. The pharmaceutical companies who are producing drugs, and they do a great job for the country, but they have a financial interest in getting things approved. The Lancet, or not the Lancet, but the New England Journal of Medicine has recognized this in a recent publication. On the front page, they said that they had some people on their advisory committees who had made some comments and made some recommendations that had financial interest, and they hadn't scrutinized it properly, and they apologized for it and said it wasn't going to happen again. And so what I asked Dr. Boyle, and what I'm inferring here today, is that there can be a bias if people are being paid or reimbursed by pharmaceutical companies when they start making a decision or a recommendation on an advisory panel. Now, you said that if they're representing Merck or Bristol Myers or some other laboratory, they will probably excuse themselves from voting. and there may be a requirement for that. That does not alter the fact that they're sitting on that panel and they're talking to everybody else on that panel, and they have influence on that panel, and they do have a tremendous impact on whether or not certain things are approved or disapproved. And I think that that is a conflict of interest. And I don't see why we can't have people on advisory panels who do not have any financial interest whatsoever with pharmaceutical companies when they're approving those, because we're talking about the health of the nation. And that's something that ought to be investigated very thoroughly by this Congress. I mean, we're talking today about autism, but there's something even or as great at stake here as the autism question, and whether or not the MMR vaccine and other vaccines may be contributing to autism. And that is, are we letting pharmaceutical companies have too great an influence on the decision-making process that affects every one of our lives? You know, right now we're talking about the anthrax vaccine. They're going to inoculate every one of our military personnel, and there's all kinds of questions about the anthrax vaccine, all kinds of them. We've had all kinds of side effects that we've talked about, and I've talked to people who have had them. And the former chairman of the Joint Chiefs of Staff is on that board of that company that makes the anthrax vaccine. And they're manufacturing millions of doses of this vaccine, and every member of the service is going to have to get 6 shots at that. And if the decision-making process involves people who have a financial interest in it, outweighs the potential side effects of any drug, then I think there's something amiss. And so I have great concerns about that, and I would just say to you that HHS and CDC and FDA and all of them ought to take a hard look at whether or not they have people on their advisory panels that have a potential conflict of interest by getting money or something else from a pharmaceutical company.
Red alert, red alert. Give me 1 second. Holy moly. What in the name of Sam Heck is this guy talking about, everybody? Did you just hear that? I think what I just heard was Dan Burton, who's running the committee of the, covering these concerns of vaccines, childhood vaccines, and an autism link. I think he brought up a parallel to the United States military receiving an anthrax vaccine. Isn't it also odd that the hype-upped, highly visible connection between the MMR vaccine and autism disorder, framed in a way that's an unsolvable riddle, around 1996, 1997, occurs at the same time that the word bioterrorism is coined. Now, I did find one use of the word bioterrorism in 1988, only one, before 1996, and it was used by none other than Patrick Leahy, the senator who received one of the 2 anthrax letters. How's that? But anyways, here we are. I have to go back. I was starting to speculate this yesterday. I suspect that the orchestration of this mystical, unsolvable autism MMR link, and even the introduction of Andrew Wakefield onto this public stage happened at the same time the concern of a large-scale biological or bioterror attack in a major U.S. metropolitan center was introduced. These two things are mirroring each other. They're happening at the same time. Let's go to the archive here. So let's examine the round table photo. And the round table photo, I think it was 1998, is this. So the round table photo is the event is the White House Roundtable on Biological Warfare preparation, not prevention, preparation. And let's see who's there. So it's Bill Clinton. And next to Bill Clinton is Donna Shalala. Donna Shalala is looking at Bill Clinton. Now, Donna Shalala was just spoken about pretty extensively as the director of the National Institutes of Health. Donna Shalala also went on to become a key, like a leader in the with the bipartisan biodefense committee throughout the 2000s. Donna Shalala is also a key person who was stumping in Pennsylvania for Al Gore to become president during his presidential run in the year 2000. And Donna Shalala also was very vocal and enthusiastic about putting forward funding for a cancer research lab in a rural area of Pennsylvania, repurposing an old hospice care center in Windber, Pennsylvania. It became the Windber Breast Cancer Research Center, which wound up being about 10 or 11 miles from where I believe a missile, not a plane, hit. And that was Shanksville, Pennsylvania, and what was claimed to be the crash site of Flight 93, but there was no plane there. That's also the center where Robert Malone was put in charge of setting up the IT infrastructure and training their scientific director, a Nigerian named Richard Somiari, to run that center. And this center was going to be testing various breast cancer therapies or vaccines, which seem to be really peptides, but also tracking and interpreting breast cancers in the U.S. military, because for some reason there was an expectation of increased cancer in the U.S. military. Going back to what Dan Burton said is here, they're ramping up for the U.S. military to receive an anthrax vaccine. Now, what Dan Burton isn't saying, or what Dan Burton doesn't know, is that the anthrax vaccine that he's talking about is from Bioport, is an old school anthrax vaccine. It actually did involve some of the work of Bruce Ivins. But more importantly, that company and that factory is under endless scrutiny. And there's even been, allowed criticism and questioning of that vaccine to be made very public. Soldiers saying, it hurt, I got sick. It was very public that soldiers should have the right to say no because the old anthrax vaccine is bad. They can't make it fast enough. The company has violations. And the alternative to that anthrax vaccine that Dan Burton is talking about here would be a new generation anthrax vaccine, such as one from Vical Corporation, VICIL, where coincidentally that's where Robert Malone's most important intellectual property lies. And that vaccine would have been pushed should there have been a successful, large-scale biological terror attack in a major U.S. metropolitan center. Going back to the photo here of Bill Clinton, sitting across the table from Bill Clinton is Joshua Lederberg, who I just showed was a main advisor to Ronald Reagan on the 1986 Immunization Act, which was mostly pushed by Waxman, who's running this, who's the Democrat at this hearing. But also, this is the person that was appointed by Donald Rumsfeld to run the internal Pentagon investigations around 9/11. He was appointed in October or November of 2001. And sitting a couple over from him is Craig Venter. You know, Solera Corporation, sequencing, genomes, Human Genome Project. Next to him is Jerome Hauer, who was a New York City emergency response coordinator, who was appointed to a special NIH or bioterror preparation role on September 10th, 2001, and who was with Peter Jennings on the day of September 11th, 2001, saying Building 7 is looking shaky. Next to him is Thomas Monath. Thomas Monath happens to be the boss of Robert Malone, for a little while anyways, at Newlink Corporation. When Robert Malone was working at Newlink Corporation, it was requested by the Defense Threat Reduction Agency that they hire Robert Malone, that Newlink hire Robert Malone to effectively be the business middleman between Newlink and Merck Corporation. Merck, of course, also makes the MMR vaccine. And you can also see that John Podesta is also there, but I think he's out of the camera view. Excellent show yesterday, and great opportunity and visibility for Jonathan Cooey, Gig Biological, on the Kim Iverson show. I had the debrief later on with him, and I talked with a few other people, in particular my top advisor, who's really Mrs. Housatonic. That one of the challenges that we have in our messaging is the why. You know, what's happening and why is it happening, right? If you were to have a murder a crime investigation, first things first is always motive. Why? Now, you don't have to, you can't ask why endlessly, but you'd be like, why did this person kill their spouse? Oh, because they had $20 million insurance policy and they didn't like them anyways. They wanted to get a divorce or something like that. Motive. I mean, you don't need to then say, well, why would somebody want money? Or why do relationships fail? I mean, you don't have to take it to its, you don't have to go on forever, but you have to establish motive. So why? What is happening and why? The why is, and I've been rephrasing this multiple times throughout yesterday and today, okay, yesterday evening and today, is the art and the practice and the policy of vaccination must be protected and continued, because it is the gateway to advancing knowledge of the human genome and understanding the machinery of life to allow for healthier lives and ultimately possibly life augmentation or life extension. Now, I know I'm going to rephrase that many, many times, but let's break that down, okay? The ability to vaccinate people is the gateway, is the key, is the portal, is the way to attain information about the machinery of human life. So someone may say, well, what do you mean it's not about protecting people? It's like, well, it is about protecting people if you assume that there's going to be enough learned over time to cure cancer and allow people to be healthier and live longer. But immediately, it's not really about protecting people. And it's been decided at some point that there was so much information that could be learned. More information could be learned through having people available for intramuscular injection and then lifelong observation than anything else. In other words, the general population becomes effectively test animals and test subjects. And it is so important to perform that using intramuscular injection. If you were to learn from lab animals, you would be injecting them with things and making observations, and because you're injecting and breaking and so on and so forth, eventually you need to you get rid of the animals. But it's the belief that the way to advance that knowledge is through vaccination. Someone may ask, has this always been the case? The answer is no. There were vaccination catastrophes around World War I and World War II that made it clear to some people that it wasn't actually protecting people. However, the nature of the catastrophes made it clear that they were going to learn so much by intramuscular injection that they needed to continue the art in the field and the practice of vaccination. Isn't it crazy that the people who represent the very top of this, such as Craig Venter and sequencing genomes and so on and so forth, is right there worried about anthrax vaccines and biological terror? Isn't it crazy that the people at the top of the Human Genome Project are right there controlling the narrative for COVID-19? Isn't it crazy that people at the top of the Human Genome Project were there for AIDS? And so on and so forth. It just keeps going on. And much of this is actually protected at the top level of national security, because much of this intellectual property and these arts have a connection back to the Manhattan Project, a project which coincidentally started and came out of World War II, the same time that vaccination turned from really being a policy which was believed to protect public health to a policy which was about using the public to obtain information to advance the knowledge of the human genome, and thus ultimately someday, hopefully, save lives, advance, our ability to augment humans, to increase lifespan, and so on and so forth. That all of these things would be possible, but only if people remained available for intramuscular injection. And Anthony Fauci, Robert Malone, many people said it going into the pandemic. Vaccination rates were dropping. Vaccine hesitancy was increasing. Now, the money's poured into these things from the United States government, whether they sell the vaccines or not. It's not really about the money for the corporations. Vaccine hesitancy was real, not because they need to protect people against viruses, because they need people to make themselves available. Now, there's a lot of other colors to this, right? It's not just that. There's population, issues with an aging population. There's a lot of other sub-issues and minor things. It's sort of like saying, a motive of, you want to live a long, healthy life, so you're motivated to eat healthy, right? I mean, that's such a simple statement. Of course, you want to have some good meals, some cheap meals. You don't always get the good food. Maybe people have depression. I mean, but it's such a simple, broad statement. And the statement of, we need to maintain the art of vaccination. We need people to remain hopeful and accepting of vaccination, because that is the key. That is the gateway to advancing knowledge of the human genome. There you go. And now you just tie all these things together. Now you would see why sometime this committee here, what's behind the scenes is that the ability to use the U.S. military for experimental gene therapy vaccines, such as from Vical, because the old anthrax vaccine was unsafe or couldn't be made fast enough, would have been so important, because the U.S. military at this time in 2000, 2001 is the only population, possibly worldwide, but definitely in the United States, where you can track every vaccine, which vaccine, how many vaccines, vaccine dates, and you actually track the medical records of the people who are effectively your test subjects for the rest of their lives. Only the U.S. military provides that. No wonder why they kept the U.S. military around. No other population could offer that. And it's so crazy that the term of bioterrorism, the worry about a biological terror attack, and all of the excuse machine to old anthrax vaccines don't work, we need gene therapy, and it needs to be done in the U.S. military, and it needs to be tracked, is happening at the exact same time that all of the confusion is being put out there about connections of vaccines and autism disorders and everything else, and everyone's going to be so confused. Now, there was a genuine concern, I believe, about people not accepting vaccines. So there really is a motive for people to not think about it. And even more nefarious is that the opposition isn't giving people a useful alternative. It's not actually providing insights. Andrew Wakefield isn't helping people figure out how to escape a wet paper bag, even though all you need to do is tear it in any direction. They're so stuck thinking that maybe they're going to find some causal link between a real virus that actually exists and is spreading and pathogenic and a single component of the MMR. But they'll never find a reproducible signal in that way. What Andrew Wakefield should be saying is, hey, look at people who never get jabbed, and you're going to see they're taller, they're higher functioning, they sleep better, they probably even have more kids as adults. He's not saying that, though. He isn't saying any of that. He's keeping people trapped. So, I'm just going to go back a minute or two here. This is 3 hours, 46 minutes. What I'll probably do is, again, I may take some clips out of this, but I still need to cut out all my commentary and make a single 6-hour posting of all of this. Okay, so let's just go back here to Wakefield. And it's Wakefield that brings up the topic, or leads to the topic of the anthrax vaccines. Wakefield, who then goes on to work years later, 25 years later, after having made no progress, with Merrill Nass, who is a chief person responsible for creating doubt in the old anthrax vaccines, and Robert Malone, whose intellectual property at Vical was going to be the new anthrax vaccines. And a Wakefield who just co-authored a paper 3 years before this hearing with Peter Daszak of EcoHealth Alliance. And Wakefield, who will then go on to work with what? Brian Hooker, make sure Brian Hooker stops talking about vaccine damage or an injury, and ultimately Brandy Vaughn, who sadly dies mysteriously in her bathroom in December 7th or December 8th, 2020.
It's not there. It means that our hypothesis was wrong in terms of we could not find it using the technology. So we have gone on record as publishing both positive and negative data.
I ask unanimous consent that this documents from the Autism Autoimmunity Project be put in the record. And I would note, Mr. Chairman, you're also associated on the board of this group too.
Without objection, that's no problem. I see this as a little bit different situation. The pharmaceutical companies who are producing drugs, and they do a great job for the country, but they have a financial interest in getting things approved. The Lancet, or not the Lancet, but the New England Journal of Medicine has recognized this in a recent publication. On the front page, they said that they had some people on their advisory committees who had made some comments and made some recommendations that had financial interest, and they hadn't scrutinized it properly, and they apologized for it and said it wasn't going to happen again. And so what I asked Dr. Boyle, and what I'm inferring here today, is that there can be a bias if people are being paid or reimbursed by pharmaceutical companies when they start making a decision or a recommendation on an advisory panel. Now, you said that if they're representing Merck or Bristol Myers or some other laboratory, they will probably excuse themselves from voting, and there may be a requirement for that. That does not alter the fact that they're sitting on that panel and they're talking to everybody else on that panel, and they have influence on that panel, and they do have a tremendous impact on whether or not certain things are approved or disapproved. And I think that that is a conflict of interest. And I don't see why we can't have people on advisory panels who do not have any financial interest whatsoever with pharmaceutical companies when they're approving those, because we're talking about the health of the nation. And that's something that ought to be investigated very thoroughly by this Congress. I mean, we're talking today about autism, but there's something even or as great at stake here as the autism question, and whether or not the MMR vaccine and other vaccines may be contributing to autism. And that is, are we letting pharmaceutical companies have too great an influence on the decision-making process that affects every one of our lives? You know, right now we're talking about the anthrax vaccine. They're going to inoculate every one of our military personnel, and there's all kinds of questions about the anthrax vaccine, all kinds of them. We've had all kinds of side effects that we've talked about, and I've talked to people who have had them. And the former chairman of the Joint Chiefs of Staff is on that board of that company that makes the anthrax vaccine. And they're manufacturing millions of doses of this vaccine, and every member of the service is going to have to get 6 shots at that. And if the decision-making process involves people who have a financial interest in it, outweighs the potential side effects of any drug, then I think there's something amiss. And so I have great concerns about that, and I would just say to you that HHS and CDC and FDA and all of them ought to take a hard look at whether or not they have people on their advisory panels that have a potential conflict of interest by getting money or something else from a pharmaceutical company that they represent. Now, I'm not saying, I was not trying to impugn the integrity of Dr. Offit, but I did want to point out that he does get money from Merck and gets some benefits from Merck. And so for anybody to say that he can be totally unbiased, you know, is questionable. Maybe he would be totally unbiased, but it is questionable. And so I think that, you know, this whole issue of whether or not the MMR vaccine is a problem. The measles vaccine has been found in the gut. It's been verified, and we still have this problem. And the question was whether or not it goes from the gut up to the brain and is a contributing factor to autism. But the companies that make the MMR vaccine have people on the advisory boards that are participating in the decision-making process. And so, you know, it makes me wonder whether or not we're really going to get to the bottom of it unless we go to outside entities. And that's not questioning anybody's integrity. It's just saying if somebody is getting, if I'm paying somebody money for some product or something, and there's something else that I'm going to make money off of, and they're on a board that's going to make a decision-making process, participate in a decision-making process, to say that they don't at least think about me and think about where the money's coming from, just boggles my mind. I think most people would. With that, do I have any more questions? Let's see what else we have here. Okay. Okay, Dr. Boyle, for your information, at a public meeting in Brick Township in January of 1997, and you should know this, with CDC and others present, several audience members asked about the vaccines and the possible autism link, and they asked that that be checked. That's from Andy Napoli, the legislative director of Representative Chris Smith. And so I again want to stress that we want to have an answer from CDC. If parents in that township were wondering about the possible connection between these vaccinations and autism, why didn't CDC check on it? Why not? You're checking on everything else, the other environmental concerns around there. Why not check on the vaccine? And I submit that maybe, just maybe, it's because the pharmaceutical company that manufactures it had some influence on the people that were in that meeting, and they said, hey, we don't want to get into that. And if that's the case, that's damn near criminal. And with that, I'll be happy to yield back the balance of my time and let Mr. Waxman have his 5 minutes, and then we'll go to the next panel.
Thank you, Mr. Chairman. I'd like to have Dr. Spiker come forward, if he would. Dr. Spiker.
Spitzer.
Oh, Spitzer,
S-P-I-T-Z-E-R.
I'm sorry. And just, where are you a doctor? How are you?
I'm professor of epidemiology at the Faculty of Medicine at McGill University in Montreal.
When you came forward a minute ago, you appeared to be reading from a prepared statement. Did you have a statement written out that you read from?
Yes, I did. The circumstances are that I personally learned of this hearing and of related activities very late in the game. I have been an honorary assistant to 2,100 families in the United Kingdom who have great difficulty in getting scientific help and can't afford it. I have chosen on this issue...
excuse me, did you prepare that statement yourself before the hearing?
Yes, I did.
Okay, and were you contacted, or did you contact Chairman Burton's staff before your testimony?
I did so indirectly, to the best of my knowledge, through a person named Ms. Barbara Fisher.
And could you identify Barbara Fisher? Is she a...
She's here in the audience.
Is she a staff person for the committee?
No, she's in the vaccination...
when did you talk to her? Was it today or earlier than today?
I spoke to her yesterday and the day before yesterday by telephone.
About
and
coming here?
Met her this morning.
Yeah, but you talked to her yesterday, the day before, about coming here to testify?
Yes.
Okay. Thank you very much. Dr. Offit.
It was primarily for the press conference, but with the possibility of being able to testify as well.
Yeah. Some extenuating circumstances for which the rules didn't have to be observed. Dr. Offit, the chairman says he's not impugning your reputation, but sounds to me like your reputation has been impugned. You get money from Merck, they make the vaccine, you're an advisory committee for the CDC about vaccines. It's a apparent conflict of interest. Again, why isn't it a conflict of interest?
Because as I sit on the Advisory Committee of Immunization Practices and make recommendations for children in this country, the only thing I consider is exactly how I would treat my own children. I mean, I take the job very seriously, and so the recommendations that I make are based solely on a careful review of the data that are presented to us, period. I don't have any conflict with regard to that decision-making process. It's simple in that sense.
Dr. Boyle or Dr. Schwartz, what would happen if you excluded people from your advisory committee that worked in the area of research on vaccines or in some other area for a pharmaceutical company?
Those with the greatest expertise on vaccines and those who are best able to make recommendations that will protect the health of American children frequently have done research in vaccines. They are the ones who know the issues best and who can make the best recommendations. By including them on the advisory committee, but implementing appropriate controls to make sure that there are no apparent conflicts of interest, the CDC feels that they get the best advice to make the best public health recommendations.
How about people who are funded by the Autism Autoimmunity Project? Have you ever heard of that group?
The ACIP meetings are all open public meetings. They're all
what is ACPI?
The Advisory Committee on Immunization Practices meetings are all open meetings and are announced in the Federal Register. If someone from that particular institute wanted to come and to share information or to present to the ACIP, they would certainly be welcome to do so.
And would you feel they have a conflict of interest if they're funded by an organization that wants to have scientists establish a certain conclusion?
I think the most important thing that we need to consider is the quality of the scientific data and whether those data have been peer-reviewed, whether they've been considered by other scientists, and whether they've been replicated in other laboratories.
All right, I apologize. Again, I'm not going to be able to finish replaying this. I have to do some cleaning here, and I'm actually going to need to cut my own network connection to my studio here. I mean, I could use my home Wi-Fi, but it won't work well enough. I'll restart this later on. See, we are 3 hours 54. We still have 2 hours to go, and I could analyze this thing for weeks, and we just might do that, or we won't. We'll see. All right, guys. Thank you. Take care. I heard Jonathan Cooey would be alive at 11:11 today. 11:11 was that when your clock looks best? Peace. Love you. See you then.
And if it's wrong, as I fear it may be, by advertising this